I'm going to take a look at your nose. The external nares appear to be patent. With the otoscope, we'll take a look at the internal nasal mucosa and the turbinates. Those are all, they're moist and within normal limits. And I'm going to feel on the front of your head, tell me if any of this hurts. Palpating the maxillary and frontal sinuses are non-tender. And with gloves and using a tongue blade and pen light, I would take a look at the mouth. So I say tongue blade. Okay, good. Looks good. Good. Good dentition. Oral mucosa is pink and moist. The tongue, lips, gums, and hard palate are all intact. Go ahead and swallow for me. And no difficulty swallowing. The voice is clear. The uvula was noted as midline. Testing the glossopharyngeal and the vagus cranial nerves are all intact. And let's take one more quick peek again. Okay, good. And the pharynx, posterior pharynx, is free of arrhythmia, edema, and exudate. No tonsils are present. Now I'm going to have you stick out your tongue, wheel it side to side. Good. And now you can close. Symmetry is noted. No fasciculation is present. Hypoglossal nerve is intact. Now, with your neck, I'm going to take a look at your neck. So look up, then look down, look side to side, and then kind of make a circle with your head. Flexion, extension, rotation, lateral bending of neck are intact. Full range of motion is present without restrictions. And I'm going to feel on your neck here. Let's see, pre-auricular, post-auricular, occipital, submental, submandibular, tonsillar, and superficial cervical and post-cervical. Supraclavicular lymph nodes are all within normal limits, non-tender, and not enlarged. Using posterior approach, I'm going to palpate the thyroid gland. I'm just going to feel on your neck here, move it side to side a little bit. No enlargement or nodules, no tenderness is noted. Now I'm going to feel around the insides of your armpits a little bit here. And palpate the axillary, central, lateral, pectoral, and subscapular lymph nodes. And again on the left side, the axillary, central, lateral, pectoral, and subscapular lymph nodes, all non-tender, not enlarged, within normal limits. The shoulders and clavicles are symmetrical, no deviation is noted. I'm going to palpate your shoulders. No tenderness at the sternoclavicular, the acromioclavicular, or the subarachnoid areas are noted. None of that hurts, right?
No.
Now I'm going to have you lift your arms up to the side and put them down, and then up forward, and then down, and then make circles with your arms. Flexion, extension, abduction, adduction, internal and external rotation performed without limitations. Full range of motion is present. None of that hurt, correct?
None.
Looking at the cranial nerve 11, go ahead and shrug your shoulders against resistance. Good. It's intact. And I'm going to take a look at your elbows. Inspect the elbows. No deformities noted. Palpating the epitrochlear nodes. No tenderness. No edema noted. No tenderness and no edema noted on the left side either. Go ahead and bend your elbows up and stretch them out, and then turn your hands like that. Good. Flexion, extension, supination, pronation are all intact without limitation. Full range of motion is present bilaterally in both elbows. I'm going to take a look at your pulses. Okay. Checking the brachial and the radial. Brachial and the radial pulse are +2 bilaterally. Now I'm going to test your strength. Have you push up against my hands, and then push down, then put your arms up like this, and pull against me, and then push against me. Good. Strength of the upper extremities is 5 out of 5 bilaterally. Taking a look at the chest is elliptical in shape with an AP to transverse ratio of 1:2. Expansion is symmetrical bilaterally. And take a look at your carotid. Feel for your carotid pulses, one at a time. +2, +2. Take a listen to your carotid pulses. Okay. No roots heard of the carotid pulses bilaterally. Now you can breathe normal. I'm just going to take a listen to your heart. The aortic, pulmonic, tricuspid, and mitral valves are heard. The rhythm is regular. The rate is 80. There are no gallops or murmurs noted.